Look what I'm wearing.
Ah,
Is it a look? Is this a traditional Indian costume?
it's a gown we use for during the Ayurvedic treatments.
Okay, so we're in an Ayurvedic clinic.
Yes, yes.
Okay, so where are we? Maybe you because we're in India, of course. So, and maybe you tell where we are and who you are and what we're doing here.
Yeah,
Want to start?
myself, Dr. Ajitha, Chief Medical Officer at Somatheeram Ayurvedic Center. Yeah, service of 30 years.
You're
Yeah.
working here?
Here, not here, altogether completed 30 years.
30 years in Ayurveda?
In Ayurveda.
Okay.
Okay.
Okay. And
Yeah.
since how long are you working
I
here?
was here 25 years back, 4 years.
Wow.
Then joined the government service.
Uh-huh.
After completing the service, I rejoined here.
Oh.
One and a half year.
Okay, so
Okay.
now you're here for 1.5
Yeah,
years.
yes.
Okay.
Yes.
And yourself?
Yeah, myself, I'm Dr. Sreejith. I have been working here since past 9 years.
Okay.
I have altogether around 20 years of experience.
Okay.
Yeah, we are in Kerala, the birth home of Ayurveda.
Okay.
Yeah.
So we
And Somatheeram is the one of the main leading hospitals in Ayurveda. We are the among the top hospitals in Ayurveda,
Okay.
promoting the essence of Ayurveda worldwide.
Okay. Maybe you can explain what Ayurveda is, what it means.
So Ayurveda is basically science of life. Ayu means life. Veda means science or knowledge. It's a very ancient system of medicine originated in Indian subcontinent because the different sages were present and around 5,000 years ago. They used a lot of experimentations with the plants and plant products. They did a lot of research using the plant products, experimented on different ailments, and whatever research they found, they wrote in compiled textbook forms, and that forms the backbone of Ayurvedic studies even up to the present day.
Okay, so it's really an old kind of medicine.
Yes, yes.
And traditional. Okay.
It's very ancient, almost 5,000 years back it was originated.
It's a long time.
India's traditional holistic health therapy.
Okay.
Okay.
Maybe you can tell a little bit about your history, like your professional history. I think you studied at the university, I guess.
Yeah.
And what did you do after? And how did you decide that you want to work in Ayurveda? So what was the reasons for you to want to work in Ayurveda?
Yeah, we are interested in health science, yeah.
Uh-huh.
And after completing the 12th standard studies, we joined at Ayurveda College, Thiruvananthapuram. Here itself studied 6 years, 5.5 years course and 6 months of house surgency.
Mm.
Then started the practicing. Very interested in our health science, especially working here is a wonderful experience at Somatheeram.
Okay.
It's original Ayurveda you can get here, yeah. All the therapies, Panchakarma, the house, Kerala is the house of Panchakarma.
Uh-huh.
Kerala's own traditional therapy, Panchakarma treatment. You can experience all the Panchakarma from here, yeah.
Okay. Okay. So what was your history?
So I also studied from the same college, the Thiruvananthapuram Government Ayurveda College, and I was from childhood itself I was very much interested in Ayurvedic studies, how to cure diseases and how to balance the doshas. Doshas is like the energy, bioenergetic energies in our body, and Ayurveda believes that the balance of which is causing health and imbalance of which is causing disease. So I was very much passionate about studying Ayurveda, and I studied in the Government Ayurvedic College, and afterwards I started practicing. I worked in various other hospitals, and I found the Somatheeram is the best hospital where I can have my career and my own professional goals. So this is the best choice that
Okay.
I had.
Okay, so you think it's good for me that I'm wearing this?
Of course. Of course.
Okay, so if you would go, like, on the first day I arrived, you did a very long interview.
Yes.
I was very impressed about the
Yeah.
deepness, how you wanted to know
Yeah,
everything
yeah,
about
yeah.
my health history.
Yes.
And you were explaining what Ayurveda is, so it's got different parts that come together in one medicine, right? Is that so? So what different parts is Ayurveda made of that are important for health?
First, you mean in terms of consultation, the detailed consultation history,
Yeah.
The case history of each patient needs to be taken, because that is the backbone of Ayurveda. Individualization and customization are the hallmarks of Ayurveda, because we treat for the patient and not just for the disease. So knowing each and every, even if it is minute details regarding your health, is very important for us. That is why we do a detailed consultation.
Mm-hmm.
Upon your arrival itself, we will analyze your vikriti, that is the imbalance of the energies, as well as we will assess your prakriti, that is the body constitution. Body constitution can be analyzed through the various questionnaire that you fill out in our questionnaire that we have produced after a long research, and as well as through the physical examination, pulse diagnosis, tongue examination. There are 8 types of examinations. We call it Ashtasthana Pariksha, the 8 different types. So we need to analyze that in detail, then only we come to a conclusion which body constitution you are. And we design a treatment plan accordingly, the most suitable treatment plan for you, and we do the treatments every day. Based on your health issues, we do short consultations before starting off each treatment every day, and we can amend the therapies accordingly. And we can provide you with the internal medications based on your ailments. And once you finish your therapies here, we generally suggest follow-up medications when you are back in your home for up to a certain time period, like 3 months or 4 months, whichever is determined by the doctor.
Okay. So treatment means 2 hours massage. Every day, 2 hours massage. You remember the first day? I was going, 2 hours massage every day, and it's very, very long. So if you want to do a treatment, it's very,
2
very
hours and more also we are doing. We have many packages. This is the Panchakarma Chikitsa now you are doing. We have rejuvenation therapy, that's Rasayana Chikitsa, that also for 2 hours. Then anti-aging program, we have more than 2.5 hours. Slimming program for the obesity,
Okay.
weight gain. Then beauty care program, skin therapy,
Ranging
all
between
packages,
2 to 3 hours,
Okay.
different programs.
So it's a big variety of different,
Yes.
all depending on what the person is like.
Yes, yes.
It's
And
different.
as the doctor told you, we will do the diagnosis by 3 methods. First, by seeing a person. Darshanam. In Sanskrit, it is called darshana, physical appearance. Then sparshana, by the body examination, nadi pariksha and the Ashtasthana pariksha, doctor told. And prashna means communication. For that, we are giving this questionnaire. As a conclusion of this is the diagnosis. And the difference between the modern medicine is they treat disease or symptomatic. We treat the person as a whole.
Okay.
And Ayurveda give importance. Prevention is better than cure.
It is.
Yeah? Yes.
And cheaper also. That's the main reason why we sit here, because I told you about the interview with Plogsties, who was reporting about like people who had their knees and hips removed and got big operations for lots of money instead of just having a little bit of gymnastics and some different food. Like if you would go to an Indian doctor, like if you are sick and you go to an Indian doctor, would you get Ayurveda or would you get other treatment? What kind of treatment would you expect as a normal doctor in India?
A normal doctor, in the sense we have different types of medical systems.
Okay.
Ayurveda is the traditional system.
So it's big in India, the whole of Ayurveda?
Ayurveda. Then we have homeopathy, Siddha, Unani, they are all coming under the holistic system, and we have the allopathic, that is the English medicine.
Okay.
So different medical systems are there. So depending on which doctor you are approaching, they will treat according to their system.
I see.
Generally, in Ayurveda hospitals, we give you Ayurvedic medicines and therapies based on our assessments, different herbal oil preparations, external therapies, internal medications, all that we can provide for any of the diseases that you mentioned.
Okay, so if you grow up in India, just to understand, if you grow up in India, you grow up with a choice of different medicines. So from a child on, you would
all
be
the health science have its own importance. If you have an emergency, that means an accident, you can go to the modern medicine, not for Ayurveda. Okay?
Okay. I understand.
Yeah.
So if you would go, it's like if you would go to a doctor with you have a flu or a sick stomach or so, would you get or you choose before? I want this kind of medicine. I want this, and this is the patient who's choosing it.
Yeah, there is options available for the patient.
Most of the people believe in Ayurveda.
Okay. So it's it's the most important thing, because in Germany we have Heilpraktiker, which means alternative kinds of medicine. But the politics, they want to get rid of the alternative medicine, and so it's very interesting to hear that here it's really a popular kind of medicine, and it's still staying that popular. Yeah. So your aim or your goal is to make people healthy, to feel good, so that they come back for recreation and not for sickness again.
Maintaining proper health, that is we call samadosha, that is equality of the three energies. Sama Agni, that is proper digestive power. Samadhatu, that is proper maintenance of bodily tissues. Then Malakriya, that is proper elimination of the toxins from the body. Then only a person is called perfectly healthy.
Okay.
And also, not only that, the person should have de-stressed. That is, stress should be out. Mental health is also important. One should not be stressed, or if you are anxious, nervous, if you are having nervousness, thoughtfulness, etc., that also comes under major straining factors to the body. We need to eliminate all of that, not only for the body but for the mind also.
Okay.
So we incorporate yoga and meditation into the Ayurveda.
Okay.
And that has shown very much good effect.
Okay. Yeah, because that's really amazing, because you get up, like you have 3 different times in the day where you can go to the yoga. You have 2 meditation times. So it all comes all together, and it's your, like, you want us patients also to go to the yoga and to go to the meditation. I skipped meditation. I never went to the meditations inside. These are very bad.
A sound mind in a sound body is important.
Okay.
Especially the pranayama is very beneficial for all the respiratory disorders. If you have like asthma, bronchitis, or congestion in the chest, if you regularly practice pranayama, you can improve your health naturally, and your breathing will be much more effortless.
Okay. I see that.
Stress also, it will helpful.
Okay. I see there's a lot of aspects you wouldn't find in German normal medicine, I think. So you mentioned detox. What role does detox play here in being healthy?
Every people will have the tendency to accumulate the toxins from their body, toxins in their body. We call it ama. That is basically the undigested food particles. Whatever you eat, sometimes it gets properly digested, but sometimes not so much. So depending on your agni, the digestive fire. So periodically eliminating these toxins are necessary for proper health, we call it the proper well-being of the patient, and proper mind and peace of mind. So periodically eliminating the toxins, that can be achieved through Panchakarma therapies.
Okay.
Pancha means 5, karma means actions. So Panchakarma means 5 types of actions through which you are able to cleanse the system. We have like therapeutic MSS, then purgation therapy, different types of vasti, that is the enemas, oil enemas, decoction enemas, then nasal medication through the nasal route, administration of herbal medicines, and even the bloodletting, that is an ancient practice involving the leeches, the leech sucking out the impure blood.
Okay.
So that these are all together known as Panchakarma, 5 actions.
Okay. Because I was telling you about my mother who had Parkinson,
Yeah.
and we went to different doctors in Germany. It was always about the tablets, more, less, weighing the tablets. And then I went to Switzerland with her, and they did a test about heavy metals, and they said she's full of heavy metals. So first thing was detox every week.
Yeah.
And for me, that's logical, because if the body is full with toxins,
Yeah.
you can't like
Yeah.
get the power of the medicine.
Proper elimination of the toxins, then only through which your body can absorb other different medications, like herbal formulations that we are providing to you for each and every disease. Different formulations are available. Only if it's a clean system, it can be properly absorbed in the body, and you can find the results only after that.
It makes sense.
Yes.
It just sounds easy.
Yeah.
Yes. So thank you that this interview could happen, because I see you are very, very busy. Yeah, it's got patience, and so I sneaked into the 5 minutes we have now. So thank you very much.
Thank
Anything
you.
you want to add as saying goodbye, as a final words from you?
We would advise you to experience Ayurveda for proper maintenance of health, and you are always welcome to Somatheeram, the traditional home of Ayurveda.
And patient care is important for us. Yeah.
Yes.
Please do.
And you will find the link to Somatheeram under the video.
Okay.
Thank you very much.
Thank you.
Thank you.
Thank you.
Bye bye.
Bye.